and then also a set of injuries. When a bomb goes off, it's not a clean type of trauma because they pack those bombs with batteries and wires and all kinds of metal fragments and sometimes biological agents like fecal matter and things like that. So it was a set of injuries in your patient that you didn't see in the United States. Multiple penetrating traumas, multiple body parts injured at the same time. It was really common to have 4 or 5 surgeons operating on somebody at the same time. You have an orthopedic guy amputating a limb while I was doing brain surgery, and the general surgeon would be stopping some torn jugular vein in the neck, and the heart surgeon would be fixing an aortic injury at the same time on the same patient. So it was just crazy sort of things like that. And then having to figure out on the fly how to fix injuries that you never see in a civilian hospital.
Mm.
And, we'd have somebody with some devastating piece of their skull just missing and scalp missing, and we'd have to move tissue from the thigh or something and try to figure out how to close this wound, and things you just don't know how to do, and you don't know that you can do it until you get there. So it was a real test of your training and your mental state, and can you work in a stressful environment and all that stuff. And then we were supposed to be the leaders. The doctors were supposed to be the ones who set the tone. So if we freaked out every time something happened, then everybody else would too.
Mhm.
And so all of that, and then I think some of the psychosocial things like taking care of the bad guys, taking care of the
Mm.
the guy who blew this guy up, and then in the triage setting, like in the United States, when we talk about triage, it basically means that you go out to the ER and you look at your list, and this guy's a little bit sicker than that guy, so he can be seen first. In Iraq, it was like there are 4 people who are all dying, and which one may you be able to save if you go a little faster with that one, and the other 3 might die while you're doing that. And so it was like literally like I've got an 18-year-old American here who's got a really serious injury. I've got a 26-year-old terrorist who set this bomb off. He's dying faster than the American. I got to take care of him first. Like we had to make decisions like that. Like sometimes I might make a decision that could result in somebody dying, and that responsibility is on me. And so that was something we just never have to do in the United States. And so it was very interesting and challenging.
How many surgeons were over there at a time? How many did you have to work with?
We had one other neurosurgeon, and then we had, I think, 5 or 6 general surgeons, a couple of vascular thoracic surgeons, ear, nose, and throat, because there was a lot of penetrating mid-face and neck injuries. We had a plastic surgeon, a pediatric surgeon, 4 or 5 orthopedic surgeons, and then an ophthalmologist and a urologist. Surprising how often those 2 guys had to operate because when those bombs go off, fragments go every direction. They hit the body armor, so there's not as much chest trauma, but there'll be a lot of sort of genital and eye trauma. And so the ophthalmologists and the urology guys were busy a lot.
Were you in use being worked every single day?
Every day. Yeah. So I was there for a little over 4 months. I did 200 operations, and that was just neurosurgery operations. So we were commonly, if it was a bomb that went off and hurt a bunch of people, and there wasn't anything that I needed to do neurosurgery wise, I would scrub in and help the orthopedists or the general surgeons, or hold a limb up for them to
Mhm.
amputate. You're always working like constantly, and that's why the Air Force actually deployed us for only 4 months at a time, because the Army hospital in Baghdad was a much more sort of traditional hospital, and it was a little bit outside of the combat zone at the time we were there. And the Army surgeons deployed for a year, but they had multiples of them, and they didn't work as many hours in a row, so they could last longer. Basically, we just would we you couldn't work somebody 24/7 for a year, and they couldn't survive it. So the Air Force shortened up those deployments and made us deploy several times in sequence. So if I actually got deployed within the last 6 months that I was supposed to be in the Air Force, and so if I had not been getting out shortly after I got home, I would have gone back to Iraq 6 months after I got home. So it was just a kind of a rotation like that.
Mm. What it's the oath physicians take, the what is it, the Hippocratic Oath? Do no
Yeah,
harm.
version of it, yeah.
Um, I've never thought about that until what you were saying, having to make the decision between, Americans and the terrorists there. But it's one of the few oaths that transcends, it sounds like, national borders, nations.
Yeah.
It sounds like it's more closer to religion than it is to something political or something like that. The religion of medicine, of doctors. How did that weigh on you? Was that, I mean, I imagine that's a hard choice.
It was. And again, it's one that you're not really trained for because we
Yeah.
don't see that sort of thing in the United States. There's always another doctor, there's always another operating room, there's always somebody else who can take care of another equally injured person, or you could send them to another hospital. And so it was, you didn't want to be wrong. I mean, obviously, there were times when you thought a particular patient might be sicker or dying faster, and the other guy gets worse a lot faster than you thought they would. And there were a couple of times when we brought 2 people to the OR at the same time and basically did 2 procedures simultaneously because it was just a toss-up and didn't want either one of them to die. These were young men, mostly men. There were a few women and children, as well, but you didn't wanna be the one who made the wrong choice and somebody died as a result of it, and then find out you couldn't save the guy you were working on. It was a lot of stress involved in that. It was hard.
When we say neurosurgery or neurosurgeon, is that a general all-encompassing term? Is there more specific types of neurosurgery and neurosurgeons? Can you specialize in a certain thing?
Yeah, there's a lot of different specialty areas within neurosurgery. It encompasses the profession encompasses brain surgery of all types, spine surgery of all types, so neck and back surgery, ruptured discs and sciatica and those kinds of things. And then peripheral nerve surgery, so things like carpal tunnel releases and ulnar nerve trouble and brachial plexus injuries and any kind of nerve surgery. And then vascular stuff, so carotid artery surgery and brain aneurysms and things that relate to the blood supply of the nervous system. So all of those areas are encompassed in general neurosurgery training. And then you can subspecialize into pediatric neurosurgery and take care of the whole host of diseases and disorders of the pediatric nervous system. You can do vascular and focus on aneurysms and blood clots and things like that. You can focus on tumors, brain tumors, and brain cancers and spinal cord cancers. You can focus on trauma. You can focus on spine. There's a whole host of different types of specialty within neurosurgery.